Welcome back to LiveHealth, your trusted space for deep, evidence-based insights into health, nutrition, and chronic disease prevention. Today, we're shining a light on something that often flies under the radar: the subtle early warning signs of undiagnosed type 2 diabetes. These signs are often easy to miss, but identifying them early could be the key to preventing lifelong complications. Why early detection matters. Before we dive into the signs, let's start with the why. According to the CDC, nearly 1 in 4 adults living with diabetes in the US doesn't even know they have it. And with type 2 diabetes, symptoms often develop slowly and can be brushed off as normal aging, dehydration, or just fatigue. But that delay in diagnosis is dangerous. By the time most people are diagnosed, significant damage may already have occurred to their blood vessels, nerves, kidneys, or eyes. That's why recognizing the early, often overlooked signs of diabetes is not just helpful, it could be life-saving. 1. Frequent urination, especially at night. Let's start with one of the earliest and most telling signs: frequent urination, medically known as polyuria. When your blood sugar is high, your kidneys go into overdrive trying to flush the excess glucose out of your bloodstream, but there's a limit to how much they can reabsorb. Once overwhelmed, glucose begins to spill into your urine, pulling water with it. This results in more frequent trips to the bathroom, especially at night, disrupting sleep and quality of life. If you find yourself waking up multiple times per night just to urinate, this could be more than just aging or a full bladder. It could be a red flag. 2. Unusual and persistent thirst. Alongside frequent urination comes excessive thirst, or polydipsia. Your body is losing fluid rapidly through urine, triggering a compensatory thirst mechanism. The more you pee, the more dehydrated you become, and the thirstier you feel. This creates a vicious cycle: drink more, pee more, and repeat. Here's the catch: sugary drinks like juice or soda only worsen the problem. They temporarily relieve thirst but spike your blood sugar, accelerating the cycle. If you're feeling constantly thirsty, even after drinking plenty of fluids, that's something worth getting checked out. 3. Skin changes you can actually see. One of the most visibly telling signs of insulin resistance, the precursor to type 2 diabetes, is a skin condition called acanthosis nigricans. This appears as dark, velvety patches of skin commonly found on the back of the neck, underarms, groin, or inner thighs. It's not just a cosmetic issue. These dark patches are a result of elevated insulin levels stimulating skin cell growth, especially in areas exposed to friction. Think of it this way: if your body's insulin isn't doing its job effectively, it compensates by producing more. Those high insulin levels can activate growth factors in your skin, leading to thickened, hyperpigmented areas. So if you notice dark patches that don't wash off, don't ignore them. They may be trying to tell you something about your internal health. 4. Skin tags. Small but significant skin tags, or acrocordons, are soft, flesh-colored growths that often appear in areas like the neck, armpits, or groin, basically where skin rubs against skin. On their own, skin tags are usually harmless and very common. But multiple skin tags, especially in someone who is overweight or sedentary, could be a sign of underlying insulin resistance. Insulin affects growth pathways not just in your internal organs, but also at the level of the skin. So while skin tags are often brushed off as nothing, a sudden increase in their number or appearance in clusters should prompt a conversation with your doctor. 5. Recurrent skin or urinary infections. High blood sugar isn't just a problem for your pancreas. It's also a feeding ground for bacteria and fungi. Chronically elevated glucose levels weaken your immune system and provide an ideal environment for infections to grow. People with undiagnosed diabetes may experience recurring yeast infections, abscesses, or slow-healing cuts, especially in areas like the groin, underarms, and skin folds. One particularly concerning issue is recurrent urinary tract infections, UTIs. Remember, excess glucose can be excreted in the urine, turning the bladder into a perfect medium for bacterial overgrowth. If you've been dealing with frequent infections or delayed healing, your immune system might be telling you something deeper is wrong. What do these signs have in common? All these early warning signs, urination, thirst, skin changes, and infections, point to one underlying issue: insulin resistance. Insulin resistance is when your cells no longer respond efficiently to insulin, making it harder for glucose to enter cells and be used for energy. As a result, glucose builds up in the bloodstream, leading to the symptoms we've discussed. And here's the key takeaway: These symptoms often show up long before your blood sugar is high enough to meet the criteria for diabetes. That's why it's so important to listen to your body and seek medical advice early. Take action today. If you've noticed any of these signs in yourself or a loved one, don't ignore them. Early detection gives you the best shot at reversing insulin resistance, avoiding complications, and protecting your long-term health. Get your hemoglobin A1C checked, especially if you're over 35 or have risk factors like family history, being overweight, or a sedentary lifestyle. It's a simple test, but it could change everything. If these early signs of diabetes are missed or ignored, the consequences can be devastating. Chronic high blood sugar doesn't just float harmlessly in the bloodstream, it actively damages the body from the inside out. The longer glucose remains elevated, the greater the risk of long-term complications, many of which are irreversible. 1. Nerve damage, diabetic neuropathy. One of the most widespread and disabling consequences of uncontrolled diabetes is nerve damage, known medically as diabetic neuropathy. High blood glucose is toxic to nerves, but the damage isn't just direct. Elevated sugar also impairs the tiny blood vessels, vasa nervorum, that supply oxygen and nutrients to peripheral nerves. As these nerves become starved and inflamed, patients begin to experience numbness, tingling or burning pain, loss of sensation, especially in the feet and hands. This often begins subtly, but over time it becomes more pronounced. What makes neuropathy especially dangerous is that patients may not feel injuries. A blister, a cut, or a nail puncture can go completely unnoticed. Without pain to act as a warning, small wounds can worsen into deep ulcers or serious infections. 2. Structural changes in the hands. Stiff hand syndrome and trigger finger elevated blood sugar doesn't stop at the nerves. It also causes glycosylation of collagen and connective tissue, leading to stiffness and restricted movement in joints and tendons. One example is diabetic cheroarthropathy, or stiff hand syndrome. Here, sugar molecules bind to the collagen in skin and soft tissues, making them thick, tight, and less flexible. Patients may notice difficulty extending fingers fully, a prayer sign, where palms can't meet fully when hands are pressed together. Another common condition is trigger finger, in which a finger gets stuck in a bent position and then suddenly snaps straight. This occurs because of inflammation and glycosylation in the tendon sheath, which prevents smooth gliding of the tendon. Both of these conditions are more than just annoyances. They're mechanical evidence of systemic damage from poorly controlled blood sugar. 3. Deformity and collapse of the foot, Charcot foot. When neuropathy combines with poor circulation and repeated microtrauma, it can lead to one of the most dramatic complications, Charcot foot. In this condition, the structure of the foot breaks down. Tiny stress fractures accumulate, but because the patient doesn't feel pain, they continue walking on the damaged foot. Over time, the bones collapse. The arch of the foot flattens or reverses, leading to a rocker bottom appearance. Severe deformity follows, often requiring braces or surgical intervention. What's most alarming is that many patients with Charcot foot don't complain of pain, again due to nerve damage. This makes regular foot checks essential for anyone with diabetes. 4. Infections, ulcers, and amputations. Neuropathy isn't the only factor that increases risk. Diabetes also suppresses immune function and reduces blood flow, a deadly combination when it comes to fighting infections. Wounds heal slowly. Bacteria thrive in glucose-rich environments. Minor injuries can become deep, infected ulcers. Left untreated, these infections can penetrate to the bone, resulting in osteomyelitis, a condition that often leads to amputation. In fact, diabetes is the #1 cause of non-traumatic lower limb amputations worldwide. In many cases, the path looks like this: neuropathy, unnoticed injury, infection, poor healing, gangrene or sepsis, amputation. This isn't rare. It happens every day in hospitals around the world. 5. Gastroparesis, digestive paralysis. Beyond the limbs, diabetes can also affect the autonomic nervous system, especially the vagus nerve, which controls stomach motility. The result is a condition called gastroparesis, or delayed gastric emptying. Symptoms may include bloating, nausea, vomiting, a sensation of fullness after eating only a small amount, erratic blood sugar levels due to delayed digestion of carbohydrates. Gastroparesis complicates diabetes management by making meal timing and insulin dosing unpredictable. Even with perfect diet and medication, patients may still struggle to control their glucose due to delayed absorption. How it all connects. At first glance, these complications may seem unrelated, What do hand stiffness and foot ulcers have in common? The answer lies in one central mechanism: glycosylation. When blood glucose stays high, sugar molecules attach to proteins throughout the body, in nerves, tendons, skin, and organs, altering their function and structure. This process causes tissue stiffening, inflammation, poor healing, and eventually functional decline. That's why type 2 diabetes is not just a blood sugar problem, it's a full-body metabolic disease that slowly dismantles the body from the inside out. The cost of delay. By the time most people are diagnosed, nerve damage has already begun. Some changes, like neuropathy and Charcot foot, are irreversible. Others, like trigger finger or gastroparesis, can only be managed, not cured. The tragedy is that many of these outcomes are preventable with early diagnosis and intervention, which is why the early signs discussed previously, frequent urination, skin changes, constant thirst, must not be dismissed. Recognizing early signs is crucial, and understanding the long-term damage is even more sobering. But the real power lies in what we do next. The good news is that type 2 diabetes is both diagnosable and, more importantly, largely preventable. In this section, we'll explore how diabetes is diagnosed, who should get tested, and concrete science-backed strategies to reduce your risk or manage the condition before complications develop. How is type 2 diabetes diagnosed? Diagnosing diabetes today is simpler and more accurate than ever before. No more tasting urine like doctors did in centuries past. The most reliable test is called the hemoglobin A1C test. 1. Hemoglobin A1C. Your 3-month average hemoglobin A1C, HbA1c, measures the percentage of glucose that's chemically bound to hemoglobin in red blood cells. Since red blood cells live for about 2-3 months, the result gives us a long-term view of your average blood sugar levels, not just a snapshot like a random glucose test. A normal A1C is below 5.7%. Prediabetes is between 5.7% and 6.4%. Diabetes is diagnosed when A1C is 6.5% or higher. This test is invaluable because it helps detect diabetes before symptoms appear or when symptoms are still vague and nonspecific. 2. Who should get tested? The American Diabetes Association recommends everyone over the age of 35 should have their A1C tested at least once every 3 years. However, you may need earlier or more frequent screening if you have any of the following risk factors: family history of type 2 diabetes, overweight or obesity, especially with abdominal fat, sedentary lifestyle, high blood pressure or abnormal cholesterol levels, history of gestational diabetes, belonging to higher risk ethnic groups, e.g. South Asian, African American, Latino. Even if you're young and otherwise healthy, if you've noticed the early signs we discussed, increased urination, unusual thirst, skin changes, recurrent infections, you should get tested immediately. 3. Why early diagnosis matters. Early diagnosis opens the door to prevention and reversal. Unlike type 1 diabetes, which is autoimmune and permanent, type 2 diabetes is strongly tied to lifestyle factors. When caught early, especially in the pre-diabetic phase, it's possible to reverse the process and restore insulin sensitivity through targeted interventions. In other words, a diagnosis doesn't have to be a life sentence, but it has to happen before irreversible damage occurs. Strategies to prevent or reverse type 2 diabetes. Diabetes prevention isn't about extreme diets or punishing exercise routines. It's about consistent, sustainable changes to how you eat, move, sleep, and manage stress. Below are the 4 evidence-based pillars of diabetes prevention. 1. Prioritize high-fiber, low-glycemic foods. What you eat has the most direct impact on your blood sugar. Diets high in refined carbohydrates and added sugars spike glucose and insulin, fueling insulin resistance. Instead, focus on high-fiber foods, whole grains, legumes, vegetables. Complex carbs with a low glycemic index. Healthy fats, avocados, olive oil, nuts, seeds. Lean protein, fish, tofu, eggs, poultry. Avoid ultra-processed foods, sugary beverages, and foods high in refined starches. The simpler and closer to its natural form, the better. 2. Engage in both cardio and resistance training. Exercise is not just about weight loss, it's about metabolic health. Aerobic exercise, like brisk walking, cycling, or swimming, helps lower blood sugar immediately after activity. Strength training improves insulin sensitivity and increases muscle mass, which burns more glucose even at rest. Aim for at least 150 minutes of moderate intensity aerobic activity per week, plus 2 sessions of resistance training. Even small amounts of daily movement, like walking after meals, can lead to significant improvements in blood glucose control. 3. Maintain a healthy weight. Excess visceral fat, especially around the abdomen, releases inflammatory hormones and fatty acids that impair insulin signaling. Even a 5 to 7% weight loss can dramatically reduce the risk of developing type 2 diabetes. You don't need to aim for perfection. The goal is progress. A few kilograms lost, sustained over time, has powerful effects on blood sugar regulation. 4. Address sleep and stress. Both poor sleep and chronic stress disrupt hormone regulation, increasing insulin resistance. Cortisol, your body's primary stress hormone, raises blood sugar and impairs glucose uptake. To optimize sleep and manage stress, aim for 7 to 8 hours of quality sleep. Establish consistent bedtime routines. Practice stress reduction techniques, mindfulness, yoga, deep breathing, or even a simple nature walk. Limit caffeine and screen time before bed. Lifestyle medicine is powerful, but only when it addresses the full picture, not just food and exercise, but also recovery and emotional resilience. Smoking, a major modifiable risk. If you smoke, this is the time to stop. Smoking increases insulin resistance, damages blood vessels, and worsens every diabetic complication, from neuropathy to cardiovascular disease. Quitting smoking is one of the most impactful things you can do to reduce your risk of developing or worsening diabetes. Final thought: prevention is power. Type 2 diabetes doesn't happen overnight. It's a slow, progressive process that can be interrupted at multiple stages if you know what to look for and act early. We've seen how subtle signs give way to severe complications. We've seen how damage builds silently, even without symptoms. And now we've seen that you have the tools to stop it. Don't wait for symptoms to become complications. Screen early. Act decisively. Live healthfully. Type 2 diabetes often begins quietly, but the damage it causes is anything but silent. By recognizing early signs, understanding the risks of untreated high blood sugar, and taking action through proper testing and lifestyle changes, you can prevent complications before they begin. If you found this video helpful, like, share, and subscribe to LiveHealth for more in-depth, doctor-backed insights into your health. Stay informed, stay proactive, stay healthy.